Good morning, ma'am. I'm Joshelle Jane Teres H. Castañares, Gym 1, Section Acme. Now, I'm going to perform measuring blood pressure. So, let's proceed to procedure number 1. Procedure number 1. Position the patient in comfortable position, feet flat on the floor, arm resting at heart level on the lap or table. So, position number 2. Bare right upper arm if clothing is restricting, have the patient to remove them. Procedure number 3. Palpate for the brachial artery. Then procedure number 4. Securely center the bladder of the cuff over the brachial artery above the bend of the elbow. So procedure number 5, palpate the radial pulse and smoothly inflate the cuff until pulse is no longer palpate. Note the number. Next procedure is quickly deflate the cuff and allow the top for above 1 minute, then calculate the peak inflation. The next procedure, make sure cuff is deflated completely. The next procedure is position the stethoscope over the brachial artery on hold and position with one finger only. Next procedure is inflate the cuff smoothly and quickly to the peak and inflation level plus 3 mm in mercury. The next procedure is deflate the cuff at the rate of 2 to 4 mm in mercury per second. The next procedure is lesson for Korotkov phase 1. Note when it appear. Then next procedure is continue to deflate, noting the Korotkov phase. Next procedure is note when all sounds disappear, Korotkov 5. Next procedure is continue deflating the cuff at the same rate for at least 10 mm in mercury after the sounds is disappeared. Next procedure is deflate the cuff quickly. Then next is remove the cuff. Then next procedure is clean the airpiece and diaphragm bell of the stethoscope. Next procedure is wash hands. Then lastly procedure is record the blood pressure in patient's chart. Identify the patient, introduce yourself, and explain the procedure to the patient. So, good morning, ma'am. Kasi pangalan na to? Okay, ma'am. Ako si Joshelle Castañares, isa akong midwife. Na ako diri karon sa imuha para magkuha sa imong blood pressure. Then, next procedure, ang ikaduha nga procedure nga atong buhaton is you are comfortable in your seat. Sige, okay, ma'am. Unsay imong comfortable mag-seat or unsa? Then, next procedure is kindly ma'am, put your arm here. Okay, then I will remove this one. Is that okay to you?
Yes, ma'am.
Okay, then next procedure is I will find your pulse rate, ma'am. I will use these two hands. Then next is taod na ko siya. The next procedure is Next is wash hands. Then last procedure is the record and patient's chart. Ma'am, your